Hello, everybody, and welcome to the All About Alzheimer's live stream. Thank you for joining us today. I am Angelica Olea. I am the Senior Vice President with Assisted Living Locators. All About Alzheimer's is a live stream designed to provide families, caregivers, and professionals with practical insights, expert advice, and real time answers to the questions about Alzheimer's and dementia care. This episode is Understanding Alzheimer's and Dementia, a guide to senior living care options. So, the purpose and objective of this series is really to provide clarity, support for families navigating the senior care options, specifically memory care. I really would like to encourage all of our viewers that are joining today, please ask questions in our live Q&A. We're moderating this on YouTube, Facebook, LinkedIn. Just search for Assisted Living Locators on each platform. But please remember, we are not medical professionals and cannot answer medical questions. I'd love to introduce my guests today. For each episode, we will have guests joining us. And I would love to introduce Ryan. And Ryan, as I introduce you, can you please tell us a little bit about yourself and why this topic is so personal and important to you?
Sure, and thank you for allowing me to take part in this. My name is Ryan Myshak. I am a licensed pharmacist. I am also a certified senior advisor and dementia care certified, and I work with families impacted by dementia every day. Dementia can take a significant physical and emotional toll on those impacted, their families, and their caregivers. And it's important to me to be a resource to these families during a very overwhelming time.
Wonderful. Well, thank you, Ryan, for joining us. And our second guest today is Jennifer. Jennifer, welcome. Please tell us a little bit about yourself and, why is this topic so important to you? Why is Alzheimer's and dementia? What makes it personal to you?
Thanks, Angelica. My name is Jennifer Weintraub. I am a dementia care certified senior living advisor. The decision to place a loved one in memory care is never an easy one. The emotional burden that the families carry is very overwhelming. So as a trusted resource, I help families navigate the overwhelming and complexities of dementia care, ensuring that their loved ones get the best care possible and giving them peace of mind.
Wonderful. Thank you both so much. So we can jump right into our very first topic. So what is Alzheimer's and dementia? And I really would like to encourage everybody that is joining us today, please utilize those chat functionalities. The live Q&A is going to be open at the end and we are moderating it. So please feel free to put in your questions. Ryan, so what is Alzheimer's and dementia? Can you explain the difference between them for us?
Absolutely. To give a visual, I would recommend thinking of dementia as an umbrella under which many different forms of dementia exist. So dementia is the overall disease state, and Alzheimer's is a specific form of dementia. Other common types include vascular dementia, Lewy body dementia, and Alzheimer's disease. And Alzheimer's is the most common form of dementia, as 70% of people with dementia have Alzheimer's. And this is why the terms dementia and Alzheimer's are sometimes used interchangeably. But it's important to understand that Alzheimer's is a type of dementia. It is typically marked by key changes in the brain called plaques and tangles. And Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between brain cells. And we're going to go into a few facts about Alzheimer's disease. These facts are from the Alzheimer's Association, and these are for 2024. So I want to credit the Alzheimer's Association for providing these. Just to give you the scope of this disease, 7 million Americans are living with Alzheimer's disease. And remember, that's 70% of people with dementia. So people with dementia, that includes a higher number. 1 in 3 seniors dies with Alzheimer's or another dementia. So not necessarily dies from Alzheimer's or dementia, but after they die, they have been discovered that 1 in 3 seniors has had Alzheimer's or dementia during their lifetime. Alzheimer's kills more people than breast cancer and prostate cancer combined. So it's definitely something we don't have a cure for yet. We only have ways to treat its symptoms. And In 2024, Alzheimer's and other dementias will cost the nation $360 billion. This is cost of caregiving, cost of medical care, diagnosis, all those sorts of things. And by 2050, these costs could rise to nearly $1 trillion. That has a lot to do with increasing healthcare costs, but also the increased population of seniors. As the baby boomers become seniors, the incidence of Alzheimer's and dementia is going to grow as it's such a prevalent disease. And over 11 million Americans provide unpaid care for people living with Alzheimer's or other dementias, which is a significant amount. And 70% of dementia caregivers feel stressed when coordinating care, and more than half said navigating healthcare is very difficult. So it's a very overwhelming process. And 3 in 5 dementia caregivers say less stress and peace of mind are potential benefits of having a care navigator, with 56% saying that having a care navigator could help them become better caregivers.
Thank you, Ryan. Wow, that is just astonishing. 1 trillion in care costs. That's insane. So, I'd love to now transition it over to Jennifer. Can you give us a brief overview of, the early signs of memory loss? What are some symptoms that come along with this disease?
The most symptomatic sign of dementia is short-term memory loss, meaning forgetting a name, forgetting words, not being able to express yourself. Everyday routines become more challenging. There's difficulty completing familiar tasks. Clothes might be inside out, wearing the same thing over and over again, not showering, not taking care of themselves. Changes in planning and solving problems, missing appointments, being late, not knowing how to make an appointment. Other red flags include repetitiveness, increased forgetfulness, inability to hold a proper conversation, mixing up words and stories, things become mumble jumbled, confusion with time or place. They forget where they are, the day of the week. Instinctively, they cannot keep track of time. Other signs and red flags are misplacing things, not being able to retrace our steps. Things may end up in odd places, like a set of keys may end up in a freezer. Just not being able to put those 2 things together and where they were and where you may put them. Trouble understanding visual images or spatial relationships. Driving, noticing a red octagon. We all know that's a stop sign. That may start to not look familiar anymore. And then decreased or poor judgment. Doing things that we would not typically do that are dangerous or have high risk, like going outside in the freezing cold without a coat on, things like that.
Thank you. Yeah, I know in the early stages, we definitely see a lot of that forgetfulness and losing things, misplacing things. Thank you, Jennifer. And just a reminder for those that are tuning in, please, if you have any questions, feel free to put them in the chat and we will get to those here shortly. You can find them on YouTube, Facebook, LinkedIn. Just search for assisted living locators on each platform. So I'd like to jump into our next topic, which is understanding senior care options. So Ryan, are you able to tell us a little bit about some of these options?
Sure, absolutely. I think we'll start with in-home care being one of the options that is available. I'll kind of go over the pros and cons of in-home care. And first of all, one of the pros is that people can remain in their home, which many do prefer, and they can receive one-on-one caregiver support. Another positive is that care can be provided for activities of daily living, helping go to the bathroom, ambulate, bathe, dress themselves, eat, laundry, housekeeping, things of that nature. And another positive is that you can allow someone to stay in a familiar place, which can be helpful to those with dementia. But it's important to make sure that the home environment can be converted to a safe environment. Removing throw rugs, making sure if there are steps, they're easier to ambulate, or changing the setting so that the bedroom's on one floor, things of that nature. There's a lot of in-home remodeling that can be done to make it a safe environment. Some of the cons, around-the-clock care in the home can actually become more expensive than care at a assisted living or memory care community at some point. Also, in-home companion care, they can administer medications, which can be an issue if your loved one refuses to take medications, which is sometimes something that occurs in the moderate to severe stages of dementia. And in-home care does not provide optimal social interactions when you have a one-on-one caregiver that you might receive in a community. So that's definitely a consideration. In addition, those activities provided by in-home care may not be dementia focused and stimulate brain activity as much as those as one would receive in a memory care community.
Thank you, Ryan. And on that same topic, Jennifer, are you able to talk to us a little bit about in-home nurses versus, visiting caregivers?
Sure. So as Ryan had mentioned, in-home care is non-medical, and it includes assistance with those activities of daily living and everyday tasks. Companion care can also provide company. This is extremely crucial for adults struggling with isolation. Also, they can provide practical support. May include driving to appointments, grocery shopping, standby assistance, reading aloud, preparing light meals and snacks, whatever the senior may need. Then there's home health care, which is often called skilled care. And it's provided by medical professionals, including doctors. Doctors may visit a patient at home to diagnose or treat the illness, may periodically check in to review the home health care plan. Nurses are the most common form of home health care. Along with a doctor, a registered nurse will come up with a care plan. Care may include wound dressing, ostomy care, intravenous therapy, administering medication, monitoring general health of a patient, pain control, and other support. Then there's also physical therapy, occupational therapy, and speech therapy that can be offered in the home. Some patients may need help regaining strength, relearning how to perform daily activities, and improving their speech after an illness or injury. There's also medical social services that are available. Medical social workers can provide various services to patients, including counseling and locating community resources, and help the patient in his or her recovery. Thank you.
Wonderful. Thank you, Jennifer. So I know there's assisted living facilities, assisted living communities, and that really is more of the personal care, the daily assistance, but not specialized memory care. So Ryan, are you able to tell us more about memory care and the specialized focus that comes along with memory care?
Yes, so memory care communities are either standalone communities that specialize in memory care, or they are specialized areas within assisted living communities. And a major quality that differentiates them from other communities is that they are secure in order to keep people safe who may be at risk of elopement or wandering. Sometimes people with dementia may get confused as to where they are and leave the building, leave a home, and get themselves into an unsafe situation. Memory care communities have better staff to resident ratios than larger assisted living communities, so more attention for those with cognitive impairment. And many are also structured to provide residents with open spaces and hallways that are conducive for those who may be inclined to walk around all day or stay busy. And I'd like to show an image of a bedroom at a place called Viva Senior Living. It's a memory care community local to me in Maryland. And I want to show it just to point out that memory care communities provide a home-like setting, not an institutional or clinical setting. And residents typically, they might not be able to have their own kitchenette, microwave, or coffee pot, things that might be unsafe for them, be a risk of a fire. But they also may only have a half bathroom for safety purposes when it comes to ensuring residents are bathed in a safe environment. But it's a very nice, they're nice places. They allow them to have the feeling of being at home, and you can decorate it so that it feels like home. And that's kind of the difference between the two.
Wonderful. Thank you so much, Ryan. Jennifer, are you able to talk? Ryan mentioned the benefits of having that dedicated trained staff in the memory care communities. Can you talk about the benefits of that?
Absolutely. So there are a lot of benefits to having a trained staff, starting with enhanced safety. Dementia can cause confusion, memory loss, and disorientation, which can lead to accidents. Having trained staff be there, and they're more vigilant and equipped to manage these risks, creating safer environments by reducing the chances of falls, wandering, and accidents. Improved communication is also a pro to having a trained staff. They understand how to communicate effectively with seniors who may have trouble expressing themselves or understanding. Also, personalized care. They can tailor care plans to meet the specific needs of each individual. Behavior management. This is a big one. Skilled staff are trained to handle challenging behaviors such as aggression, agitation, or anxiety calmly and effectively. And better health outcomes. Staff with dementia care training are more attuned to unique health care issues and are able to recognize changes and respond appropriately. And then also the benefits of having a structured environment. A structured environment can be highly beneficial for dementia patients as it helps them navigate daily life more easily and reduces confusion or stress. The secured environment helps them reduce the agitation. There's predictability in structured environments. There's consistency. There's no stress of sudden changes that can cause anxiety. There's stimulation, enhanced safety, fewer risks. In a structured environment, potential hazards such as clutter, sharp objects, confusing layouts can be minimized. This lowers fall risks, wandering, or accidents, which are all common concerns of people with dementia. Clear boundaries. A well-organized living space with clearly marked areas helps patients understand their surroundings and navigate more easily, reducing confusion and potential disorientation. Having this predictability and tasks that they're expected to do fosters independence. It gives them the ability to do some things on their own. And routine, too, is empowerment. Knowing what to expect can help the patients retain a sense of control over their lives, and they're less likely to feel overwhelmed.
Yeah, and Jennifer, I think that routine is critical in having that. And the trained staff absolutely being able to deal with those aggressions or behaviors that come along with this disease. So thank you both. Let's talk about factors to consider when choosing care. So Ryan and Jennifer, what are some key considerations? We'll start with you, Ryan. What are factors to consider when choosing a care environment?
Well, I will definitely start by addressing the costs related to memory care communities. So, memory care communities are typically more expensive than assisted living communities due to the higher level of care and supervision that's needed for the residents. Some will provide all-inclusive rates for care, while others they may charge a rate for the room, plus a charge for the level of care that someone needs. Now, that level of care charge can sometimes be elusive. The level of care charge is typically formulated after an assessment of the resident's needs. The community determines the amount of physical care needed with ADLs, as well as help with their cognitive abilities. Two people can have very different care needs and still be assigned the same level of care. It really comes down to how much help a resident may need from the staff on a daily or even weekly basis, depending on how they calculate it.
Wonderful. Jennifer?
Sure. Dementia progresses through various stages, each presenting different challenges and care needs. So you may have a resident come in and just be in the early stages with mild dementia. They just may need some prompting, redirecting, or reminders. Give them emotional support, reassurance, understanding, keep them socially active and engaged in familiar routines, and track their physical and cognitive changes. As they progress and they move more into the middle stage and have increased memory loss, confusion, personality changes, difficulties with daily tasks, they're going to need more assistance with their personal care needs. Maybe need a more structured routine, establish predictable daily schedule to reduce confusion and anxiety. Also use calm, reassuring communication to handle mood swings, agitation, and aggression. And then late stages where they need almost complete help with everything with their daily activities, provide comfort and dignity, feeding assistance oftentimes, be vigilant, and create a calm and soothing environment. And then end of life, final stages, provide hospice and palliative care to ensure comfort for both the individual and the family.
Wonderful. Thank you so much. So let's jump to our last topic here that we're going to discuss. So common challenges and how to address them. So some health and behavioral challenges. Jennifer, can you touch on this for us? What are some common issues with behavioral and health challenges?
So as I already mentioned, the memory loss and cognitive decline begins. Individuals often struggle with their short-term memory, which can lead to confusion, repetitive questions, and difficulty in recognizing loved ones. So it's important to emotionally support them, offer reassurance and understanding as they may feel anxious and frustrated. And then as the disease progresses, they will have difficulty with daily tasks, completing routines. Structure and daily routines can help them feel less anxious. And then there's communication challenges, finding words, following conversations, understanding instructions. This can lead to frustration as well. So a trained staff may use techniques to foster understanding, reduce that frustration, and encourage positive interactions. And then there's behavior and mood changes, which often happen as well. Many experience mood swings, increased anxiety, behavioral changes such as aggression or withdrawal, which can be challenging for family and caregivers. So as the brain's anatomy and chemistry changes, so does their behavior. So strategies can be used to de-escalate or redirect behavior without causing distress. And then there may be the need for increased supervision and secure communities to provide safer environment for wanderers and exit seekers.
Thank you so much, Jennifer. I'd like to jump to our Q&A. We've got some questions that are rolling in. And Ryan, I'd like to start with you. So we got a question from Raylan. She asked, can you tell me how meals are managed in memory care communities? My father has a hard time with meals, and I worry about how they will deal with this.
That is an excellent question. And yes, so in memory care communities, they offer 3 meals a day and snacks. But a lot of ways they handle it differently because those with dementia may not be able to communicate or process information on a menu per se. A lot of times they'll show pictures. They may show a picture of lasagna and a picture of chicken and just say, which one do you want? And the resident can point to which one that they want. Also, they will highly encourage people to continue eating, constantly supervising, making sure that they are finishing their meal because food is very important for health and nutrition. So they definitely, and they'll even go as far if they need assistance feeding, cutting up meals, pureeing foods, special diets, and things of that nature as well.
Wonderful. Thank you, Ryan. Jennifer, so our next question comes from Monica. She asks, what is respite care and how do you typically see it utilized for someone diagnosed with Alzheimer's?
So respite care is a short-term stay. This can be used in a couple ways. The first one can help caregivers and give them some relief. If they need to take some time off, they can move their loved one into a community for a short period of time where they know that they're going to get all the care that they need, and they can have peace of mind that they're in a very safe environment. I've also seen it used as kind of a segue to memory care, where we're just going to go, you need a little rehab, let's go move into this community until you get better. And then oftentimes it's a segue to a full move into the community. But it's a great way to help caregivers and also ease the move-in process.
Wonderful. So our next question is a little more common than you would think. So it comes from Tammy from Cleveland. She says, my mother is very social despite her cognitive decline. What will her social life be like in a memory care community? Is dating even allowed? So who wants to take this one?
I can give it a shot. I mean, I have
I can chime in after.
relationships blossom in assisted living and memory care. So that is definitely, we see some of that on TV and movies, but yes, it definitely does happen. There are definitely relationships built, but also friendships as well. People are highly encouraged to participate in social activities. And even if they can't physically participate, they are at least there present to at least observe, which they also get a lot of cognitive stimulation out of that as well. So it is a very big part. The difference between assisted living and memory care is you're going to see activities all throughout the day. People are going to be out of their rooms together and doing things with one another, whether they're crafts or physical things or, cognitive memory games or other sort of social interactions.
Wonderful. Jennifer, you want to jump in on that as well?
Yes, just to also reiterate, the socializing and the interaction is so key to keeping them mentally agile and kind of help slow the decline in the brain.
Wonderful. So Kenny from Los Angeles says, hello. What happens if my father exhibits combative behavior? Will all memory cares accept him as a resident? Ryan, you want to start off? Or Jennifer?
I have had quite a few clients that have had combative behavior, and being a trusted advisor, you know which places can handle behavior best and also will be there helping with, sometimes it's getting on the right dosage of medicine. Sometimes it's just the environment. So I definitely know where is best to help that kind of behavior.
Ryan, anything to add to that?
Yeah, I think it's as long as it's not, the behaviors aren't becoming a detriment to they're not at risk of harming themselves or others, they're going to work through it. I think they're also, a good memory care is going to get to know the resident and try to get to the underlying cause of that anxiety or that stress or what's causing them to have those behaviors, so that they know how to redirect or soothe them in a way, in an effort to just even prevent them from happening in the first place. The better caregivers, that's where that dementia training comes in, and they know how to navigate those situations really well.
Wonderful. Thank you so much, Ryan. Well, we are going to wrap it up here. And I just want to thank Ryan and Jennifer. This has been so valuable. And thank you so much for your contributions and joining us today. For those that joined us on the live streams, if you want to join more and you want to be the first to know, please register. We're going to drop the links in the comment sections of each platform that you are on. And just make sure that you go to our website, assistedlivinglocators.com. Follow us on Facebook, YouTube, LinkedIn to see more. And thank you again for attending. And be sure to visit assistedlivinglocators.com to sign up for future live streams and access additional resources on Alzheimer's and dementia care. And thank you again, Jennifer and Ryan, for joining us today.
Thank you.
Thank
It was a
you.
pleasure.
Bye-bye.